Welcome, everyone, to the We Get Real AF podcast. I'm Vanessa Alava.
And I'm Sue Robinson. Please remember to subscribe to our podcast, and you can follow us on all social channels. Our handle is at We Get Real AF.
Women's health and biometric data are often an afterthought, with priority given to our male counterparts in a variety of different sectors, from medical and wellness advice, health and fitness training, to the wearable tech products being developed that rarely consider the complex and beautiful makeup of women. The way we care for our bodies and take preventative measures for optimal health are uniquely different, and modern medicine is ever-changing and advancing. So why are we still relying on antiquated medical methods with respect to diagnosis and treatment when there are better, less invasive options that are proven to be equally effective and accurate as traditional methods? Well, insert the brilliant and disruptive leaders at Mammogen, a woman-led biotech company who's using data, tech, science, and experience to shatter complacency. We are excited to welcome founder and chairman Martin Keiser and CEO Elizabeth Cormier-May as they share their innovative ways they are radically improving detection, diagnosis, and treatment of women's health-related disease. Marty and Liz, thank you so much for joining us today.
Welcome.
Thank you. Thanks for having us.
Well, before we get started, what's the best way for our listeners to connect with you online?
The best way would be to go to Mammogen's website, which is www.mammogen.bio. And there is a spot there where you could email us, and either Marty and I respond to every single inquiry, question, request. We just want to get to know you email that comes in that way.
Fantastic. All right. Well, I'm going to let you both take this away. What is Mammogen?
Oh, that's such a fun question to answer. And I think the best way to give everybody a background on who we are and what we do is to understand a little bit how Mammogen fits into a larger puzzle. And so for that, Marty, why don't you introduce the world to IV Bio Holdings, and then we can drill down to Mammogen.
Sure, sounds good. Thank you. So as Liz mentioned, I lead a bio-innovation studio called IV Bio Holdings, established that in 2018. With the sole purpose of creating multiple liquid biopsy companies, each centered around novel biomarkers, truly novel science that can allow us to detect disease earlier, diagnose disease easier, and treat disease more precisely. From a studio, kind of a big picture studio standpoint, the studio is entirely defined by three things: defined by speed, efficiency, and risk management. That's true in the way that we approach research and development. It's true in the way that we approach company creation. It's true in the way that we approach product development, all the way through to commercialization, speed, efficiency, and risk. And we compress time, cost, and risk primarily through advanced data science and emerging technologies, but we accelerate the growth and we accelerate really the traction of everything we do through creative partnerships. And so that's the big picture, sort of macro overview of IV Bio Holdings. Up to this point, there have been three companies to come out of the studio. The first is Liquid Lung, the second HepGene, and the most recent is Mammogen. And each of these companies is focused very specifically on a biological system or process. In the case of Liquid Lung, there's a focus on pulmonary disease, more specifically in lung cancer. In HepGene, focuses on metabolic disease, more specifically on non-alcoholic fatty liver disease. And then Mammogen is a pure play women's health powerhouse with a flagship focus in breast cancer. And so that's really the overarching, sort of studio, model that we've created here. But Mammogen is fairly unique in that it's the first company where we've actually hired somebody to run that entity. The other two companies are entirely virtual in every sense of the word, but hiring somebody to run Mammogen was really important for a number of personal and professional reasons. But most important was that we hire a female to run this business, somebody who can actually relate to the very problems that the company is established to solve. And through divine intervention, the universe connected us to Liz Cormier-May, who is not only an amazing leader for Mammogen, but also serves as the commercialization guru and really my right hand across all things IV Bio Holdings. So that's an overview on the studio, and maybe a good intro into Liz, into your background and a little bit more on Mammogen.
Yeah, so my background is a bit unique for a lot of leaders in this space. I actually started as a scientist. And I think that's really important to understand because I was actually in early discovery oncology working on breast cancer products. And it was just always a bit too removed from the patient for me. I loved the science, I loved what I was doing, but I had no meaningful impact. I couldn't feel or touch or see the difference I was making. And that was hard for me. So I moved over to the commercial side and have focused on trying to bring innovative solutions to patients. And one of the things that makes Mammogen so incredibly unique and special and important is not only the fact that we are women-led. We have 50% of our investors are women. Our board is nearly 50% women. All of these things are tremendously important to understand because it makes the way we function drastically different than pretty much any other women's health company out there. The majority of them, certainly the big ones, are almost exclusively run by men. There are a few exceptions, but I have to pose a pretty simple question. How can a man relate to what women go through on a daily basis? It's very simple. How can a man understand the fear that is caused when you find a lump in your breast? Or the 17 years on average that goes into suffering before a woman is diagnosed with endometriosis, or the decisions that come after figuring any of those problems out. So there's something very special about having women leading the company, making the decisions, and always keeping the patient at the end of every single decision we make. So this has brought me right back to my roots in women's health and puts me directly right next to the patient. And that's where I want to be. And it's important to understand because it's really fueling a lot of the decisions we're making and the way we're approaching product development, marketization, go-to commercial strategies, because a community, creating a sense of community is the core to all of that. It's something that makes us quite different. So I spend just as much time talking to breast cancer patients and survivors as I do looking at financial projections and creating partnerships and doing all of the normal CEO stuff, right? Because we believe strongly that in order to most meaningfully launch any product into this women's health market, we have to have a community behind us. We believe the community will incite market adoption, and we believe that the market adoption will go right back and feed our community. And this is a really different way to look at the problem. It's a very different way, different message to give to people as you're fundraising, as you're creating partnerships, as you're trying to plant your flags in the ground of women's health. And so all of these things come together in a really special way at Mammogen. And I would like to think that we will be able to preserve that simplicity for as long as Marty and I are leading this company.
I think that what you're saying is such a special differentiator, Liz, because you're right. Like there are a lot of companies doing research on very important medical problems out there, but the idea of doing that in community, the idea of having women at the helm of a company that's researching women's health problems. And I can certainly understand your desire as a female scientist to want to get closer to the women whose lives you're actually impacting. So I love all of that. Can you help us understand what is the differentiator in your approach to identifying, diagnosing breast cancer? Liquid biopsy is the overarching term. What's different about what you guys do versus what's out there?
Gosh, I love this question because everything we do is so different. So I'll do my best to simplify it. So we've been throwing around the term liquid biopsy a couple times now. Just to be clear, liquid biopsy means we are diagnosing a disease or a condition from the biofluids that exist within your body. Biofluids are anything that's not solid, right? So it could be blood, it could be tears, it could be urine, any of the fluids that we create. And that's important to understand because it opens up a tremendous amount of opportunities for physicians and patients to more effectively diagnose and treat disease. It's really hard when you need to go in and get a piece of tissue to diagnose a disease. You can't always go back in your brain and cut out another piece, right? You can't always go back into your lung and easily retrieve another piece of tissue to continue to learn about the patient's state. So being able to do these things from biofluids offers a tremendous advantage. So now everybody understands liquid biopsy. What makes us different about how we approach the market? we have a very innovative way at answering clinical questions. And our platform is the same across all of the IV Bio Holdings companies. So Liquid Lung, Hepgene, Mammogen, we all get to a set of biomarkers. Biomarkers are just pieces of information that are floating around in our body. They could be in DNA, they could be in RNA, they could be in proteins. We focus on RNA, and we can talk a little bit about why we believe that's important and advantageous. But we use a system called evolutionary modeling that looks at real live patient data, data sets that have already been created. And we are fortunate that we mine all of our data sets from the NIH. And that's important to understand because that's really about as high level of scientific integrity as you can reach. And so we are able to use the hard work that so many researchers have done and contributed to science with, take that and learn new things from it by taking enormous amounts of data, putting it into this evolutionary modeling system. That's our base platform. And what happens is the same thing that happens to people. It creates Turing algorithms. Algorithms are simple mathematical equations. And these algorithms start to behave like humans. They evolve, they mate, they mutate, they migrate. And what happens at the end of that process is we get a minimal set of biomarkers that has a maximum amount of accuracy. And that's important to understand because what we're doing is finding the best of the best to answer the question we're trying to answer. Now, that's just step one, right? Humans don't stop after one round of evolution, right? We keep going. And that's the same thing we do at Mammogen and IV Bio Holdings is we repeat that process over and over and over again until we have a relatively large set of biomarkers, all that preserve really high sensitivity and specificity in whatever clinical question we're trying to answer. And that's important because one, it allows us to oversample the biology, as we say, which means we're understanding the systematic biology that's going on inside of these patients better than anybody ever has before. And as such, we're finding biomarkers that are hugely important in not just diagnosis, but early detection diagnosis. These biomarkers have never before been associated with these cancer states, whether it be lung, breast, or metabolic, NASH and NAFL like Hepgene. Many of our markers across all the companies never been associated with these disease states before. So you have to ask yourself, well, why is that? Are we wrong? Or is nobody answering the question in the right way before? And it's most definitely the latter. And we know that because remember, I go back to the point where I said, we are using data sets and research sets that we already know the outcome for, right? So it's like we're answering questions in a new way, but we're using answers that we already know are correct, right? We already have information on these patients. We already know what stage disease they have. We already know their outcomes. And then we're looking at all that information in a new way. So we are seeing markers that have never before been seen in breast cancer. To give you an example of that, some of the 26 biomarkers that we have at Mammogen for early detection breast cancer and for rule out biopsy, which we'll talk about a little bit more later, some of them are associated with central nervous system function. Some are associated with childhood deafness. Some are associated with oxidative processes, right? But none of them ever before in breast cancer. And that's why we're able to answer what has been a traditionally very difficult question to answer. How do you detect early stage breast cancer? Well, you detect it by using our processes at Mammogen. And we have now done it in over 350 patients across multiple biofluids. So we've done it in blood, we've done it in saliva, both very interesting, right? Because as the world is moving to a more virtual healthcare model, being able to very easily collect patient samples is a huge advantage.
Mm-hmm.
I mean, just think about that for a minute. What if we can detect stage 1 breast cancer from saliva? What does that mean for the world, right? What does that mean for areas of the world where doctors don't exist, where there are no screening, there are no yearly well women visits, right? So you can start to see the impact that being able to tackle these problems is going to have for women here in the US and the world abroad. Because it's very important to remember that as hard as we're moving and as much progress as we're making in the US, there are parts of the world where women still don't even have access to physicians, period.
Exactly.
So does that answer your question?
Yeah, no, that was
You do
great.
it?
Very great.
I would love for you to tap into this because we're talking about accuracy and effectiveness, or efficacy, I should say. There was a stat that you and Marty provided to us when we did our initial phone call about women's results and diagnoses, and it was like, women age under 40 and then over 55. Can you touch on that, because I that was really impactful?
Yeah, absolutely. So the tests, there are 2 tests for our breast cancer platform, which we have named the GenTrue Breast Program at Mammogen. So there are 2 GenTrue tests. There is one for early detection. This is meant for women under 40. And this is very important to understand. Women under 40 are not eligible for yearly mammograms. And there's a really good reason for that. Mammograms were never designed to accurately diagnose breast cancer in this age group for 2 reasons. One, because traditionally women under 40 have dense breasts, simply means lumpy boobs, right? Nothing special about that. And 2, because the prevalence of disease is, as compared to older populations of women, far less. So imaging, like mammography, like any other type of diagnostic, is designed around a specific population of women. And so that means this translates to women under 40 who get a mammogram. Let's say I feel a breast lump. My OBGYN says, ooh, hey, Liz, we need to check that out. I go for a mammography. The results from that are no better than a coin toss.
Gosh, that's
crazy.
Mammography is less than 50% accurate in women under 40.
So as a result, the guidelines really, you're technically not eligible for a mammogram if you're under the age of 40 because of those 2 reasons. But when we were incubating Mammogen at IV Bio Holdings, that was just such a glaring opportunity to me. That was, I completely understand why that guideline is in place because of the limitations of the technologies for screening. But the next question was, but is that really acceptable? Do we just accept that for, at face value and just completely ignore somewhere north of 40 million women between the ages of 18 and 40? Or do we find a better solution that overcomes and solves for some of those limitations? And to Liz's point, we do that by measuring the biology, the patient's biological response to disease. Literally the way that our biomarkers get overexpressed or underexpressed when disease takes root in your body in the earliest stages. And that's the most reliable and consistent way to detect things. But the idea here, to be clear, is not necessarily to replace the mammogram or the existing standards of care. The idea here is to unlock a regular and reliable tool for screening for the women that just have no other option or alternative today. And if a result comes back positive, rule those women into the more traditional, care pathways of MRI and ultrasound and mammography, but then solve another, equally as important problem on the other side of that, which is the potential for unnecessary biopsies that come as a result of false positives from MRIs and from ultrasounds and from mammograms. And that leads into the second product that Liz was talking about, which is our post-imaging diagnostic, the GenTrue PID test, which is really designed to reduce the number of negative biopsies that get performed every year, because there's about close to 2 million breast biopsies done in the US annually, and 1.3 million of them are actually not breast cancer, which is great news that it's not breast cancer. But think about the wasted time and the costs and the stress and the anxiety and everything that, a lot of us have been through, either personally or through a family member. And it's scary. So being able to rule more of the right women into the existing standards of care, but then rule more of the wrong women out of the unnecessary procedures, those are 2 really massive opportunities. And just to close out on that point, and Liz, sorry to steal your thunder on it, but the women over 55 is really, there's a unique opportunity both for screening, but more so for the ruling out in women over 55, because in that age group, despite the fact that you're at your highest risk of developing breast cancer between the age of 55 and 70, the current guidelines only recommend mammograms every other year. So, and we all know that breast cancer doesn't wait for your mammogram year
Nope.
to show up.
Mhm.
And so you have a lot of time where there's just no regular, reliable tools for detecting or diagnosing. And so, and more importantly, in that group of women, if you're in that age group, you are at a higher risk for breast cancer. Therefore, if they see anything on an MRI or an ultrasound or a mammogram and they don't rule you into a biopsy, there's an enormous liability at stake there. And so that's one of the reasons why you see so many biopsies. But it's also one of the reasons why they recommend mammograms every other year, because they're trying to manage that process of the amount of overflow of unnecessary procedures. Again, a non-invasive tool could be a really nice way to help mitigate some of those negative biopsies, but still give a nice tool to catch it in the off mammogram year.
It almost
Absolutely.
sounds to me like, we have these somewhat antiquated diagnostic tools that we're trying to shoehorn into a wide swath of women. And it's just it's just a very rough tool. It's like using a chainsaw to do a surgery, not to be too
Yeah.
graphic,
Well,
but
it's almost a level of precision medicine, right? Like it's
Mhm.
taking precision medicine and extending it that much further.
Yeah,
Yeah.
I mean, that's it, right? In my mind, we're doing exactly what everybody is saying they want to do in medicine: find the right treatment, the right tools for the right patient at the right time.
Mhm.
When you can get all three of those things in line, that is precision medicine. Anything that falls short of that is a step in the right direction, but it is not precision medicine.
When you talk about really young women, not being screened for breast cancer, I can think of 4 or 5 women I know who were diagnosed with breast cancer in their 20s and early 30s. So, and I was shocked when I started to hear that, because you don't think about women that young getting breast cancer. But how long could a breast cancer be brewing? I mean, I don't know much about breast cancer and how long the sort of life cycle is before you pass that threshold of early detection to, it's really set in. What does that look like? Like, how long could a breast cancer be brewing in somebody's body and they don't know it? Is it years? Is it months? I mean, unpack
So
that a
that
little.
kind of depends on a number of different things, right? So most people catch breast cancer because there's some type of physical manifestation. Either we feel a lump or we don't feel good, and it leads to tests that diagnose breast cancer. Now, here's a scary thing about women under 40. Sure, our prevalence might be lower than women over 40 or over 50, but the women under 40 often are diagnosed, or more often diagnosed, with a more progressive form of the disease, and they're more likely to recur. So now we're talking about exceptionally young women who should have a full life ahead of them being diagnosed with a disease that's more likely to be worse and more likely to come back. How do we not have something better than a mammography that was never designed for them to help them through this journey, right? Question number one. The other thing to remember, these women, most women under 40, are still making very important decisions about their life, whether it be family planning. Do I want kids? How many kids? What happens when you're 35 and you're not done having kids or haven't started having kids and you're told you have breast cancer? Well, what often happens is you don't have enough time to think about, never mind answer those questions, because the second you find out and you're under 40, you are on to the breast surgery, the breast oncologist, to start your treatment and lay out that path. You don't have an extra month or two to talk to a reproductive endocrinologist to talk about, should I freeze my egg? Should I not? What are my options? What does that look like? What are the implications? You barely have enough time to sit down with your spouse and partner and say, if I have breast cancer, what are we going to do? Right? So a big part of our mission at Mammogen is to, with our diagnostic, offer them a very important gift, and that's time. The earlier we find it, the more time you have to navigate some of those really hard conversations and decisions. And that's often a piece of the journey for women under 40 that isn't thought about, right? It's just assumed, well, you have breast cancer, you're going to want to start, you're going to want to get going. Let's start the chemo. Let's get to radiation. Let's get our care team in place. Well, hold up, stop. What if I want to have another baby?
Mhm.
Right?
Liz, thank you so much for bringing that up because, I will admittedly say I haven't thought of those questions, and I don't know if, until you're in that situation or a direct family member or a close friend is going through it, those are things that people just don't talk about, which to
Right.
your point, these things happen and we need to have these conversations and not be afraid to address them. And I think fear is like the catalyst of all evil, right? When you don't address things and you prevent yourself from catching things early, to your point.
Right.
Mhm.
Right.
And
And
I want to jump
yeah,
in there.
okay.
It is, I think, the number one reason why we were so excited to be on your show and to speak to your listeners, and the title, The Real AF, because the truth is, as much as we are so proud of our science and our data and our technology, we are equally as excited about the opportunity to build a community and talk about the things that people don't want to talk about, and
Mhm.
create a centralized place to pull all that information from and have those open dialogues. We have advisors, breast surgeons that are advisors that fully buy into this mission for us, that recognize the fact that there's more than just detecting, diagnosing, and treating this disease. There are the questions about body issues. There are the questions about, self-esteem issues, marital challenges, post-treatment. There's so many things. This is not just specific to breast cancer. This is really across all women's related diseases. And we want to be able to create a place where we can actually address a lot of those things in an open, comfortable forum. Again, back to the incubation process of this company, there are certainly companies developing wonderful, immunotherapies to treat these advanced cases of breast cancer on one end of the spectrum. On the other end, you have the Susan G. Komens of the world that do a great job bringing awareness around this disease and bringing awareness around screening. There is nobody that's uniquely bridging the gap between the science and the support. And that's what Mammogen is really, was created to do, was to bridge that gap and spend just as much time talking about the solutions for breast cancer detection as we are about, creating a place where we can support some of those things across the entire journey that comes from, comes with survivorship.
Yeah.
Love
And,
it.
to get back to the original question, everybody's journey with breast cancer is individual. It's why we need to bridge the gap, right? Somebody may have breast cancer that's only been there for months and then catch it early enough to where it barely impacts their life in some ways. Other people, it could be in there for years brewing. It all depends what type of breast cancer it is. And there are lots of different types of breast cancer, some more aggressive than others, some with far better outlooks than others. How often do they go to the doctor? Do they do breast checks? All of these things really play into how long can breast cancer be there before you find it. There's no right answer because it's different for everybody. And that's why, right? That's why we need to talk about these things, not just the test and the science and the company, but we need to bring patients into every decision we make. We need to think about all of these things because that's how we create the community. That's how we become that bridge between support and science. And some of the most meaningful moments I've had as CEO of this company was talking to women and learning about things that, Vanessa, like you, I had not given thought to. And we are women and we go for our well visits every year. And I do self breast checks, right? So you feel like you've thought about everything, you've covered everything. You haven't. I talked to one woman who was post her tamoxifen year. So she's at least 5 years out of being a survivor, right? And she said, there are two things nobody ever thinks of. One, your graduation day from chemo and radiation is the scariest day. It's scarier than the day you're diagnosed because you go from having a whole team of people around you to being back out in the world but you're cured. You're never cured. You're not the same person you were the day before you found out you had breast cancer. How do you navigate that, right? And two, this woman happened to be a competitive runner. And she said, Liz, I got through the chemo. I got through the radiation. I got through throwing up every day. Nobody ever told me that chronic lymphedema is a hugely normal, prevalent aftermath of all of this care. Nobody ever told me that I wouldn't be able to competitively run again because my knees are so swollen I can barely walk. All of these things that we don't talk about, that we don't think about, that And it's not anybody's fault, right? Docs are doing the best they can. They are charged with keeping you alive. They keep you alive and they move on to the next patient that they need to keep alive. There isn't enough time for them to say, oh, hey, but this could happen, this could happen, this could happen, this could happen. And they certainly don't check back with you 5 years later to see how you're doing, right? They can't. That's an unreasonable expectation. But we can. We can assemble all of these different pieces. There are so many great groups that are already talking about this, that are already thinking about this, whether they be patient-led or other women entrepreneurs. And what if we just be the ones that bring them together? We're just assembling a care team that follows you forever for the rest of your life. That's not so hard to imagine.
Absolutely not. You gave me goosebumps. It was visceral
Mhm.
because I had never thought of that, but I can only relate it to, there was a short stint with our firstborn where she, came out and she went to the ICU. And I know, Sue, you with one of your daughters was in the ICU. And
Yes.
there was obviously this thing where we're like, oh, we just want to be healthy enough to go home and get out of the ICU. But then there's also that like day that they take her off machines that you're like, can we take one of those home? Because we want to make
Mhm.
sure that we can
Yeah.
continue monitoring. And that's the only thing that's analogous that I can feel. And I got goosebumps because you're right. Like the minute that you're off and you're like, okay, congratulations. And
Right.
you're like, hold on a second, you know?
You're flying solo now. Yeah,
Absolutely.
that's scary. And also, I think, to y'all's point, young women don't think it could happen to me, because if it's not even a recommended regular screening, it must
Mhm.
not be a thing that I have to worry about till later on in life, right?
Right.
And so so that's just got to be even more jarring. If you could talk more about how people who maybe been diagnosed, how they access this community that you guys are building.
So that's a really great question. And we don't have, it's not done yet, right? So it's still a work in progress. So we are building a community. And right now, the best way to become part of what we're building is to reach out to us through our website. But some of the things that we are building we're building a Mammogen store where you can purchase things, not tests, Mammogen labeled gear that we're using to fund a lot of our community-based endeavors, right? Because investors, and they're not wrong, they don't want to see their investment dollars go to building something that's not directly tied to revenue. We get that. We understand that. We respect that. So we're going to find new ways to bring in money so we can fund all of these community-based things. And my dream, if I look 12 months into the future, would be to have a very defined place on our website where you enter into the Mammogen community portal. And anybody who wants to partner with us and be part of what we're building is somehow represented there. And so if you need to talk to a woman after you just saw yourself the first time after having a mastectomy and you feel like your life is falling apart, well, there will be other women there who want to have that conversation with you. If you are suffering from chronic lymphedema, what if there were providers and other women and support groups who focus on that? We're partnering with this wonderful company called Brilliantly, which is a women-led company of this woman, Kristen, who calls herself a previvor. Her mom had very early breast cancer. She had a prophylactic mastectomy to ensure that that would not happen to her, and very quickly realized, yikes, I'm really uncomfortable after this prophylactic mastectomy and reconstructive surgery because my boobs are always cold. And not just like, ooh, it's a little chilly in here, like painfully cold all the time. And she started talking to other women and they're like, hey, me too, me too, me too. And she realized this is a really big problem. So she just launched breast warmers. You know, like you go to a football game and you put hand warmers in your gloves, same thing. You stick these in your bra and it keeps you comfortable. So there are so many groups and women out there creating these amazing things that we don't think of as part of the traditional clinical care pathway, but they are, and they should be. And so we're just a portal where all of these people are coming together and accessible. And gosh, Marty and I have dreamt about, releasing a Mammogen magazine every quarter where it's about what's going on in breast cancer science, what's new, what have we learned? Hey, here's some great companies everybody should look at. This is what this company is doing. This is what this advocacy group is doing. You want to be part of our community? Come in, be part of it with us. What role can you play? What value can you bring? These are all very, I would say, simple, not always simple logistically, but simple, easy ways to get answers for women in a meaningful way. I mean, how easy would it be to create the 10 questions you should ask your breast surgeon on day one in your first meeting? Here's what you need to know. Here's what you should ask.
Things that make
Those
sense.
out there.
Makes
Human
sense that you don't
things.
think about. Exactly.
Just-
Exactly.
And nobody should have to go through this alone, and nobody should have to keep reinventing the wheel, right? And I would think that this community that you're describing could also, and perhaps it already does, also include family members and spouses, because it's, you know,
Totally.
cancer doesn't just
No.
doesn't only affect the patient, it affects all their loved ones as well. So
No, I talked to
Absolutely.
one woman who said she felt like once her plan was laid out, she said, okay, I can tackle this. She said it was way harder watching her husband try to navigate it than it was for her to actually be the one navigating it. Because think about it, as a spouse, it's not you going through it. You really can't do a whole lot other than hold their hand and be there and check in, yet you're suffering just as much as they are, watching the person you love fight to live. So there has to be resources for spouses, kids, family members. You know, we talked with one woman who said the best part of all of this, the most helpful thing was that people would bring dinner to her on her chemo days because she could not cook dinner for her kids. That's something Marty and I want to do regionally, find people who will sign up for that, right? I mean, we do it all the time. Somebody passes, we bring them food, right? We're celebrating, we bring food. Why can't you sign up once a month to bring somebody in your region a dinner because she's having chemo?
So true. I just want to
really
commend
applaud
you.
you.
I was going to say
Same thing.
Just commending you on how intentional and purpose driven this mission is. I mean, obviously we're women in it, and it touches us because any of us could be there at any point in time. And we've, you know, whether that be a family member or a friend, if we haven't been there personally, we've all been kind of in circles where it's touched someone, right? And I would love to get into your own stories a little more, especially you, Marty, being I just want to call this out because it's important, our second feminist dude ever that we've had on the show. So
Yay, Marty,
you know,
yes.
you're part of the solution to this greater problem over here. But I want to talk about the importance of having a female-led team. And, you know, you touched on it earlier when you said, you know, that the universe kind of collided when you met Liz, but talk about that some more and why that was such a big deal to you.
Yeah. The incubation of this company really started when my sister's best childhood friend at the age of 30 was diagnosed with stage 2B breast cancer. And she became the third woman, actually technically the fourth in my most immediate sort of circle of whether it's family or close friends, to be diagnosed below the age of 40. That was the impetus for what's going on here. You know, there seems to be, you know, they're telling us it's not that prevalent, but in my own life, you know, in my own circle, there's 4. Take that and multiply that by everybody. And this has got to be a much bigger problem than we're being told, or at least maybe it's rising faster than we thought. And so that sparked this. Second to that is that I am married to my high school sweetheart. My wife is everything to me. We have 3 daughters together, 8, 7, and 15 months old. I have 2 sisters, 3 sister-in-laws, a mother-in-law. Women are so, I mean, I can't even describe how important women are to me in my life. So those are the personal sides of it. You know, taking that forward to the business, it just made sense, not necessarily to only be female led, but the vision really was to create an overwhelming presence of women at every level of this company. And that's, you know, obviously starts at the top. So we were so blessed to get Liz to take this role, and she's done amazing work with it. As she mentioned, you know, female board representation, a very large presence of women on our cap table from our earliest investors, which, just for context, I don't have a single female investor across my other 2 entities. And so, you know, it was super deliberate and intentional to try to unlock an investment opportunity for women, you know, and I want to continue to do that, but this just felt so perfect, you know, a perfect place to start. And I was so proud of the fact that it really worked out that way. It's technically 52% female. So, you know, majority women on the cap table. So all of that came together, and I just felt that, you know, we're approaching such a massive problem, such a massive unmet need, such a competitive field. I mean, there's no shortage of people that want to try to solve these problems. And to me, it didn't make sense to be just another end-to-end care company. I thought that this end-to-never-end community would be so much more impactful and give us that much more of an edge to actually solve these problems. And so all of that was by design. Where I really got lucky is the way it came together, and came together so quickly with so many amazing people. And we're not even a year old, but we're going to have, as a company, but in the next month or so, you're going to start seeing some really interesting accolades, awards, recognitions based on the science, the data, and also the community. So that's really the background of it, and sort of how it all came to be.
Love that.
Fantastic. Mm-hmm.
And Liz, I mean, you said you started out as a scientist. I would love to kind of hear, we often ask all of our guests kind of how they started out, because it's never like this straight linear path that a lot of people think or have in their head that that's how it is, right? Like you don't hear of someone and then the next day you hear about them and oh my gosh, it was like an overnight success, right? So talk to us a little bit about that. And also if you could integrate into that some of the, going back to liquid biopsy, what other diseases we can expect to potentially detect or diagnose using that technology. And anything new. I mean, you mentioned some things, Marty, but potentially anything that you'd like to share or unveil on the podcast. We obviously welcome having that insider information and the first and new people to say it. So feel free to elaborate if you'd like.
All right. So yeah, my path here was not linear at all. There's in fact nothing linear about it.
It's nothing linear about any of this.
No, there's nothing linear about any of
Never
this.
is.
So I was a medicinal chemist for Novartis Pharmaceuticals. And like I said, it was a wonderful place to start my career, but it just wasn't close enough to the patient. And in 1,000 years, if somebody told me at 22 when I was graduating college that someday I would be the CEO of a company, I would have told them they were nuts. I did not take a business course in school. I did not go to grad school for anything other than science. So ending up here was never in my wildest dreams. But the further as I left the lab and got my feet wet and started to learn about the business side of science, there were so many things that I just couldn't wrap my brain around. Simple things, at least they seemed simple to me. Like as a company, we spend a lot of marketing dollars trying to bring in our end users. And I'll define that as both physicians and patients in diagnostics, okay? A lot of money. Yet the second they use our product and we send the patient a bill, we don't care about that patient anymore. They're gone. Wait a minute, what do you mean they're gone? We just gave them potentially awful news. And now we send them a bill and say, be on your way. Good luck navigating that. That just doesn't feel right. And it never has to me. So as I've taken different types of roles within different types of organizations, so I could really start to learn about all of the decisions that go into product development, commercialization, and creating companies. Because believe me, there are things that go into those that you never would think about until you're doing it. But as I started to learn all these pieces, it just became more and more clear to me that I feel like we're missing the mark. As an industry, I feel like we could do better. I feel like we could bring a more comprehensive, respectful result experience to the patients. And so pretty much everything that I've done as I learned little tidbits about what goes into being successful in this industry, I always kept coming back to that one question, right? Well, how do I do this in a way that's better for the patient, more meaningful for the patient, what I consider to be more fair and more respectful to the patient? How can we do that? How can I do both? How can I keep my shareholders and my investors happy and make really good business decisions when really what the most important thing to me is the patient? How do I bring those two worlds together? And I have to say, Mammogen is really the first place that I feel like I'm actually accomplishing that I feel like I'm actually bringing together all of the things that are important to the business piece of what we do, and ultimately serving our patients. And I use that word very deliberately. Lots of people throw that around, right? Oh, the patients we serve, we're serving. You're not serving your patients if the last thing you do is send them a bill.
Oh, I
Amen.
think that is so wise. And I think regardless of what career path women who listen to this podcast or men who listen to this podcast take, you shared something really insightful, which is that you had your professional training, but you also had your gut. And you listened to your gut, and you listened to your own true north, which was, the human connection piece of this. It's not just what we're making, it's making a difference to other humans. And I think I think that when you do that, when anybody does that, when they take their professional training and they pair that with their values and their gut, and they follow their gut, that's where you really can make an impact and really have a successful career. And certainly you two are case points for examples of that.
Absolutely.
Thank you. I love that. And I got to tell you, it's not always easy to follow your gut. Sometimes
Nope.
you're the only voice in the room who
Girl.
has that opinion.
We know it.
And I got to be honest, I'm still working on that. I haven't perfected that. I haven't perfected finding my voice at the right time and standing up for myself every single time I should. That's a work in progress. I don't know that I'll ever truly nail that, but man, that is, if I could talk to every woman in college still right now, that is the one thing I would say is listen to your gut and don't give a hoot whether or not anybody else shares that gut opinion.
Amen.
Yes, ma'am. All right. Well, before we move on to the lightning round, and you can kind of just say a few of those things, but what other diseases can liquid biopsy potentially detect in the future or diagnose?
If we
It
have
could-
great data,
Mhm.
we can solve virtually any problem.
And biofluids have so much information from so many healthy living cells as well as the dying ones, and we can answer any question. And that's why RNA is so important, by the way. Those companies out there who are looking at just DNA, all they're getting is information from the dying cancer cells, right? Cancer's already done its job. It's dying. Why do you want answers then? If you look at RNA, you're getting real-time information about the patient's specific biology, response to the disease. That is why we're detecting early. That is why we can answer any clinical question.
You're
Well, that's
looking
not-
in a
I was gonna-
different place, a different.
We're looking in a different place, and we're looking at a different question. I don't care if the tumor's dying. I don't really care what the tumor just did. I care about what's happening. What's the patient's response to that?
Mhm.
How can I find the difference? How can I find the response I'm looking for to know that, hey, it's happening before I can see anything dying from the tumor?
Well, if that's not powerful information, I don't know what else is. That's awesome. Well, I think that lightning round is in order if both of you are willing to do this with us. We usually like to ask our guests a series of questions just to get them to know them on a personal level. And we'd love to hear both of your answers. And we'd like to make it fun and light, but yeah, we'd like to make it sound really intimidating at first.
I'm nervous.
Fair enough.
And then everyone's pleasantly surprised.
Exactly. Hey, Sue, start us off.
Okay. So we touched on a little bit of this, but I would love to hear from both of you 3 pieces of advice that you would give your younger selves.
You want to go first, Marty?
Yeah, it's the advice I give my daughters. It's in 3 short sentences. Life's short, move fast, but not too fast.
I would say that's great. I would say find your voice early. Don't be afraid to be the only one with an opinion, and know your limits. Know what lines you're willing to cross and which ones you're not.
Yes. All right. How do each of you define success?
I'll go first on this one.
Yeah, go ahead.
If I leave this world a better place for my kids than the one they came into, I've been successful.
Yeah, mine's almost identical. Just the number of lives that we could positively impact that's my success. And right now, very proudly, our entire portfolio of intellectual property is positioned to positively impact the lives of 220 million Americans and over 1 billion people globally. There's a lot of work left to do. There's a long road ahead of us, but that alone is something that I'm unbelievably proud of that. And I just want to see that number to continue to climb.
Yeah,
You should
I
be
hope
proud of that.
someday
Yeah.
when somebody's Googling me, I hope they're not Googling my net worth. I hope they're Googling how many people's lives I touched.
All right. And this could be within your career or just outside to lighten if you want to. What is something about each of you that people would be surprised to know?
I'm a marketing major with got a D in high school biology, and spent my whole career in finance. So really, the wrong degree from the wrong school, no business being in this business sort of thing. But followed my gut, followed my dreams, followed my passion. But I think they'd be pretty surprised to know that.
I think for me, lots of people look at me and they think, man, she's strong, or she's not afraid of anything, or she always speaks her mind. And the only reason, and first of all, none of those things are true. I'm scared of tons of things. I don't always speak my mind the way I should, or as efficiently or effectively as I should. But the only reason I can do that is because I have a husband who never, ever asked me to slow down, asked me to take a step back from my career to raise our family. He stopped working so I could keep going as what I was doing, so our kids could remain home with one parent. And if he was ever not in my world, I could not be the person I am.
He's awesome.
I love it. All right, this is a fun one. What celebrity would each of you cast to play you in a movie?
Jennifer Gardner.
Oh, I love her. I just watched
Oh.
Yes Day with my daughter. We have movie nights on Fridays, and she was just so good. I just love her. She's so like the American sweetheart, I feel.
I could see that too, man. That would be perfect. I have no idea how to answer that. I'll throw that one back
I'll
to
answer it for him. Ryan Reynolds.
Oh, all right. That'd be cool.
Okay.
That'd be cool. Yeah. Good
cool.
choices. Good choices.
I can see a little bit of I'm going to pay a big compliment because a lot of women find this man very, very attractive. Patrick Dempsey.
I was just gonna. I wondered if you were gonna say that.
Yeah,
Yep.
McDreamy. Yeah.
McDreamy. I like McDreamy.
Better than Ryan Reynolds. Yes.
I like McDreamy. McDreamy was pretty cool too, though.
They're both good choices.
But see, I like McDreamy, like Patrick Dempsey, way back, like before Grey's Anatomy. We're talking about like Can't Buy Me Love Days. That's
Sweet
like
Home Alabama.
That's a really good
Oh
one.
yeah.
Such a great movie, right? But he was like
Yeah.
the geeky kid back then, and I thought,
You hit the nail on the head with that one.
love it.
Yeah.
All right, y'all. What myth about women in your sphere of influence, and generally that's STEM and science, what myth about women would each of you like to dispel?
For me, it's that there's this notion that women can do it all and they can do it on their own. They could be a mom, a CEO, a wife, a partner, a sister, but nobody can do it all. And so if we as a community, as a world, want women to really be as impactful and powerful as possible, you need to start considering better ways to provide resources, whether that be healthcare or childcare or education, or you can't do it all.
I have thought that my whole career, like this myth that yes, superwoman, I'm woman, hear me roar. I mean,
Yeah.
You need support to roar. I don't care if you're a woman or a man, you have,
support.
right.
And we need to be able to say, no, I can't do it all. And not be afraid that somebody will say, oh, well, then she's not good enough to do this
Exactly.
or take this role. That's gotta stop.
Yeah, I have a hard time dispelling the myth. I want to more answer it as like my dream of what it could be. And, I think ultimately to get to a point where it's really not even discussed would make me happy. The fact is we wanted this company to be female led because Liz could share in those experiences with the patients that her company serves. But the reality is it doesn't matter what her sex is. She's an amazingly qualified human being with more passion, more enthusiasm, more capability, more expertise, more experience than anybody I could ever find. And so, getting to that point where it's just a level playing field. I mean, that there shouldn't even be any myths anymore. It should just be accepted. So that's sort of more my personal dream of what it could be, especially as I think about my daughters and their futures. So
I love it. All right. One last question for both of you. Fill in the blank. blank like a girl.
Fight like a girl.
I mean, there was no way Liz was going to say anything other than fight on that one. Oh man, I probably would have said the same thing on that.
Fight
I
like
would
a
give,
girl.
I'll give another one. Think like a girl.
Mm.
Women are
Yes.
powerful thinkers. We're genetically strategizers. We have to be to wear all
Problem
those.
solvers. Yeah,
Mhm.
agree. And I will
Input.
just say, as the mom of 3 daughters, also, Marty, my daughters are older than your kids are, but I so appreciate what you're doing, the example that you're setting, the message that you're sending about solving big problems and building community and caring about the people behind everything that you're doing, and that everything that you're doing is geared towards solving and helping those human beings and making the world better and empowering women to be part of that solution. I love all that. And I think we need just more voices like yours. So thank you so much for sharing your time with us today.
Thank you.
Yes,
Thank
thank
you
you.
for
And
having
Yeah, what a
us.
apart
pleasure.
from like all the amazing insights, there were 2 things that really stuck out to me. One is part of your mission statement is that end to never end solution. Like I wish a never end for Mammogen and Ivy Bio
Mhm.
Holdings. Like to echo what Sue just said, it's all the good things and it's so needed. So thank you, thank you. And Marty, when you said you have no business being in this business, I feel like we need more of those types of people integrated into all of these businesses that like need all of these certifications and this and that. Like, I want people that don't necessarily quote unquote belong to have that mind in there, to raise their hand, to be that squeaky wheel in the
Mm.
room. So thank you both so much.
I'd say our single greatest advantage across this entire thing is the fact that we are not only integrating things that typically are not integrated, but we're actually deliberately facilitating the integration of things that don't typically get integrated. And that diversity from experience to different types of science, it all comes together in just a really powerful way. It really does. And truthfully, if you look at our state of healthcare today, it's about as broken and misallocation of every human and financial resource you could possibly think of. So if you think that doing it the way it's always been done is the right solution, it's like there has to be something done differently here, and we have to approach this problem differently. So it definitely makes a difference not having sort of been groomed through that process of that traditional thinking.
Mhm.
And I think you're right. I think we should see that in more businesses and more industries. We should see a cross-pollination of ideas and experience. And I think you'll see better outcomes.
Absolutely.
Agree.
We can do better, and you both are doing it. So
Yes.
thank you again for your time.
Thank you. Oh, it's a
Thank
blast.
you.